All right. Welcome back, everybody. How was lunch? Everyone had good lunch, chilled out, got outside. Everyone's ready for the next part of this afternoon. Great. I am too. Zoom couldn't hear everyone clapping and hooting and hollering, so it's hard for Zoom to hear you. There you go. Yeah, there it is. Very good. I'm really excited for this next presentation. Neva Fairchild is a member of the Texas Governor's Committee on People with Disabilities and recently retired as a national aging and vision loss specialist at the American Foundation for the Blind and has worked in the field of blindness services for over 30 years. Kavitha and I had the pleasure of talking with her recently about the report on vision loss in older adults as relates to accessibility and the rights of Texans with disabilities, which is what she's going to be talking about today. I found it fascinating. I think you all will too. Please give a round of applause for Neva Fairchild.
Thank you so much, Eric. I'm so pleased to be here to tell you about a community that I have lived in since I was a baby. I have been visually impaired all my life. I'm totally blind now. The work I have done for the last 35 years in the field of vision loss has opened my eyes, and I hope to open your eyes to the needs of people who are blind or have low vision, especially those who are older, losing vision later in life. My creds are on the screen. I'm not sure that they mean all that much to you, but believe me, the world I have lived in is shared by over 300,000 Texans who are over 65 living with severe vision loss. And now that I'm a part of that group, I have great passion for sharing their story with you. The Governor's Committee on People with Disabilities serves people with all types of disabilities. I bring the blindness and low vision perspective to our meetings. I'm not a person to be quiet during a meeting. I'm not a person to hold back questions, and they may have regretted that the governor appointed me along the way. I want you to know that we have 12 people who 7 of us must be people with disabilities. You've probably heard nothing about us without us. That's the great independent living call from the last part of the 1900s. And that's what's important in my message to you is having people with vision loss at your table when you are designing services and planning programs. If you don't live vision loss, you don't understand it fully. I can never convey to you everything you need to know. We also have 8 members of our committee who are representatives of the state agencies that interact in the state of Texas with people who have disabilities of all kinds. They inform us, we inform them. We want to create a state where people with disabilities have full, productive lives and equal access to services and the right to live free. And you're right, we're Texas proud. So I'm going to cover a report that we created after we held a summit that actually came out of a subcommittee from the Health and Human Services Commission program on Aging Texas Well Advisory Committee. They asked those of us with low vision to come together and make some recommendations. Boy, did they get more that they wanted. We pulled together a summit of people that came together in July of 2024. Some things have changed in the last year and a half, but really in 35 years, not much has changed. People who are blind or have low vision are not getting the services they need, especially those who are losing vision later in life. The education system does a pretty good job of taking care of kids who are blind and have low vision. The adult services like vocational rehabilitation does a pretty good job of helping people find services and get help. And the older individuals who are blind program that is a part of the Texas Workforce Commission designed for people 55 and older who are losing vision later in life or who struggle to live with vision loss after age 55 serve 1% of the 300,000 plus people in Texas right now. That population is growing. By 2050, it will be almost 1 million people in Texas over age 65 who live with vision loss, and they don't know how to do even the most basic things to live their lives. We have to do something to prepare for that. We have to scale up services, and we have to bring the services to the people where they are, whether they're rural or urban, whether there's a lighthouse in their vicinity or not. Services have to get to where the people are and meet them right where they are with their level of skill and their level of need, and help them to do more and do better and live a full and productive life. The graphic that is showing has a little bit of a controversy because it says 7.3% of people over 65 in Texas live with severe vision loss. And the report that the Vision Serve Alliance created from the 2019 American Community Survey says 9.73. Okay, let's split the middle, 8%. I don't know which one is right. I'm not a statistician, but I know we worked hard to find out these numbers to empower you to know what we're facing in Texas in terms of older people losing vision and to be prepared for the growth. I know you've heard the statistic, 10,000 baby boomers are turning 65 every day. Okay, nationwide, that's about 9% of that 10,000 is a person with vision loss. In Texas, I'm sorry, in the United States, it's about 7%, and in Texas, it's between 8 and 9%. That's a lot of people. And they don't know what they don't know. They don't know you can live with vision loss. They probably don't know anybody who has vision loss. For the rest of you in the room, and maybe those online on Zoom could raise your hand, how many of you know someone who is blind or has low vision now in your lives? Clap once. Okay, pretty good. Because a lot of people tell me, I've never met anybody who's blind. I don't know anything about vision loss. I think you probably are like the cream of the crop because of the work you do. And that's a good thing. But your staff and the people you work with in the community, the partners you make and collaborate with, also need to learn about vision loss and the effects it has on people's lives. There are a lot of service providers out there. The work group that we pulled together had representatives from a lot of those organizations. Vibrant Works in San Antonio, East Texas Lighthouse, the OIB program, lighthouses from across the state, area agency on aging representatives, the ATWAC, Aging Texas Well Advisory Committee, we had a couple of those members, and we had our Governor's Committee on People with Disabilities Executive Director on the working group that put this report together and planned the summit that informed it. The the, the legislative mandate to improve access to information for people living with vision loss who are aging resulted in a page on the HHSC website that I have to admit is so well placed that I can't find it, and I know it's there. Which means if you have a family member, you're the adult child of an older individual losing vision, or you're the provider at a local aging services, you can't find it either. And so the outreach campaign, we're asking for a lot of things to change so that outreach and marketing can be done by all of the state government agencies that serve people who are blind. It's super important that the world knows that there's a lot of people who need help and where to send them to get that help. Can I just make sure what number slide I'm on the big screen, please? Okay. Okay, thank you. So the campaign is to reach out to all healthcare providers, all aging service providers, all families, and all people with vision loss who don't know there's help out there. And that's going to take a coordinated, collaborative effort on all of our parts. We made a lot of recommendations. You have access to the PDF of this report. I lost count at 40. I remember reading past 40, so I know there's more. And there are some that we can focus on that will make the most impact. The outreach and marketing, I think, has to happen because people who are older losing vision later in life don't know they're not alone. They don't know that there are other people losing their vision and struggling to live life, struggling to read their mail, struggling to write down a phone number and read it later when somebody calls and says, I need you to look up this information, Mrs. Smith, and get back to me before the end of the day, if at all possible. And Mrs. Smith has nobody living in the house with her, and she has no way to look for that information, to read that information once she finds it, or to read the number she wrote down and dial the phone back. I was so happy to hear about warm transfer earlier. That's so important when somebody knows to call 211. They call 211 and they get information and they say, okay, I'm going to give you the phone number. You want to call that place? Here it is. And they don't know, they can say, would you please connect me? I can't dial the phone and I can't write down a number and read it. Hallelujah that that's available. So we want to actively leverage programs that already exist, that are already working with people who are aging to understand blindness. I have to tell you, I've made a lot of visits to senior centers, to senior computer training programs, to senior meals programs, to talk about blindness and low vision. And you know what they tell me? We don't have anybody. We don't have anybody who can't see well. Well, how many people over 65 do you serve? Oh, about 300 a month. Okay, somebody do the math. 9% of 300, and they don't have anybody. The reason is the person doesn't identify. They're embarrassed. They don't want to admit they can't see well. They don't want their family to know they can't see well because then son, daughter, niece, nephew might decide they need to go into skilled nursing or assisted living. The independent living community where they live might decide they need to be upgraded to assisted living when they don't really need to. They just need skills taught to them. And they don't go to the program programs, again, once they've been there and it doesn't seem to work for them, they can't see the screen on the computer training. They can't access the buffet meal at the senior center. They can't see where to go and sit because the wall of windows has an east facing and it's morning and the sun is glaring in, and the white floor and the white chairs and the white table look like a blizzard in front of them. And they don't feel comfortable asking for assistance to find a seat, to find the restroom, to go to the coffee bar. Those kinds of things make people decide, I can't do this. So there's a lot of programs out there that people can access that they don't know about, like IRA is a program that you have to have a smartphone because they have to have a camera, but you talk to a trained, vetted guide, an agent that describes the scene to you. Mrs. Jones, if you walk straight ahead, you're going to encounter a set of stairs. Be cautious, you're getting close. Okay. Now move a little to your right and put your hand out and you'll feel the banister. And then was I using Jones? I forgot. Mrs. Whoever can find her way around a little bit easier because she essentially has a pair of eyes using the camera in her phone to guide her. Not everybody can afford that. There are other programs like programs that will train trainers to train staff to give them the skills to work with people who are blind or have low vision. When they encounter somebody at the sign-in desk or even at the pharmacy countertop, and they bend forward and get very close to try to sign, or they're squinting at you, this is a clue this person might not be seeing very much. And how do you address that? There's ways. Mrs. Jones, are you having trouble reading your prescription labels if you're at the pharmacy? Is it difficult for you to sign that registration form? Could I help? And then that's a clue to pass along to other staff. This person does not see well. They may need a little bit of extra assistance. And it's so hard to know what to do, but I have the easiest question on the planet for you. Whenever you encounter somebody with a disability, whether it's vision or not, how can I help you? Not, can I help you? That's a yes/no question. That turns off the conversation. No. Okay. So some people will say, no, I'm fine. I'm okay. I know where I'm going. And that's all right. I do ask you, though, that if you're on a street corner and the person says no, and they're about to step out in front of a bus, please stop them. Okay? It will remove the tragedy from your life and theirs. Okay? But if they're not in danger and they're moving and doing what they need to do, let them make their mistakes. Let them use their skills and then be happy to help when they say yes. Or if they're looking lost again and you encounter somebody who said no one time, they might not say no now if they aren't where they thought they were and they can't find their way. It's just it's just kind of a human interaction thing that most people are scared to try. And I promise you that it doesn't hurt much unless they bite your head off. And I'm thinking to myself, gee, do I want to tell people that people who are blind or have low vision come in the mean and kind of not so friendly versions? They do, because we're just like everybody else. We come in all shapes and sizes and with all kinds of personalities. Don't take it personally. They've snapped at somebody else already today. So we want to support training throughout the state, and we hope that you will collaborate with us to do this. So we want to create a state work group that includes a lot of partners. I hope Blooming Health will be one of those. And we want to curate a list of programs that do training that is housed somewhere that the public can get to. Maybe it's housed with a state agency, maybe it's housed with 211, ADRC, I don't know, but it has to live somewhere so that we all can access it. I know about a lot of programs. I don't know about all the programs. You probably know about some of the programs. I bet you know about one or two that I don't know. And we need to curate that list so that people can access it, both service providers and families and individuals who are blind. The OIB program has a guide to independence for older people who are blind or have low vision, and we need to turn that into something other than a booklet. So the comorbidity of vision loss with all other healthcare, chronic illnesses in the healthcare arena is pretty dramatic. People have diabetes at almost twice the rate, heart disease at almost a third again more of the rate of people without vision loss. And so when you think about going to a healthcare provider and you're diagnosed with a heart condition and it's high cholesterol related, and they give you a booklet that has the diet you're supposed to follow, the things you should avoid, the things you should eat, and you hand that to somebody who has low vision, where do you think that booklet's going to go? In the trash. They can't read it. And if they don't admit to you that they can't read it and you don't know they have vision loss, then you can't provide them something that is more accessible. Earlier, I heard 5 minutes? Yikes. Earlier, I heard a great idea that the intake questions have to be broad. And so, you ask somebody directly, do you have vision loss? No. Okay, let's ask it in a way that maybe they might admit to what they're having difficulty with. Do you have any difficulty reading regular print? When you get your mail, for example, do you have any difficulty reading what's in the, well, I can't read it too well anymore. Some of it's kind of tiny print. What about seeing someone across the street who's waving at you? Can you see that? Oh, no. I know my neighbors think I'm a snob because they tell me, I waved at you, you didn't see me. Then you have some clues that they might need some vision intervention. And then intentional collaborations between the TWC OIB program and their other vocational rehabilitation program as well, and other state agencies is so important because we touch the same families. As somebody was talking earlier about, we serve the same families in WIC and in ECI. We need to share information. We need to collaborate for them. So one of the things that is most serious in our state is a vast shortage of vision rehabilitation professionals. Part of that is because there's not enough university programs training people in this field nationwide. We do have 2 here in Texas. We're very blessed. And yet they can only produce so many students a year. The other reason that we don't have enough professionals is they're not getting paid at equal rates as occupational therapists, physical therapists, and yet they're providing very similar levels of training to people with vision loss. And then the third thing is that the state is so big and the workers are so few that they're traveling, their windshield time far outweighs their in-person visits with folks that they need to serve. They also don't have the ability to purchase assistive technology that would help a person, a talking clock, a talking blood pressure machine, a phone that can enlarge the text or speak out loud. They can't purchase those kinds of things because anything vision related is not covered under Medicaid or Medicare and is not considered durable medical equipment. If you have an orthopedic disability, you're covered. If you have a vision disability, you're not. So the improvement of access also needs to include in Medicaid funding for some of those vision-related services for older people as well as kids. Whoops, hang on, I advanced and I didn't mean to. And then the recruitment and pay challenges has to be addressed at the legislative level as well. The Medicaid paying for, even for the orientation and mobility services is also necessary. And the legislature has to address this. And the governor's committee made recommendations along this line last session, and we're going to make more this session. And some of it improved. The OIB program got an extra $1 million for the Senior Keys to Independence programs that they're doing at 2 lighthouses right now, and they're about to increase that to 4 lighthouses. I'm going to skip that one. So expanding outreach includes being at the table and talking about vision loss at all the aging conferences, the technology conferences, the healthcare conferences. I was so excited to be invited here today to be able to say this to all of you because you need to hear it, and I beg you to please talk about it. What about a person who is blind or has low vision? How are they going to do this? You fill in the blank at your organization. The recommendations are vast, and I know that. But if you read that summit report, it's going to help you understand the need. And if you share that summit report with your staff and your colleagues, it will help expand the awareness across Texas. And we have to sustain the investment in the programs that serve folks who are blind or have low vision. And that's at risk, as it is for everybody's programs these days with the changes in federal funding. And we have to prepare for that 1 million people that in 2025 is going to need services. If we're only serving 1% now, and we're only serving 1%, that's going to leave a lot of people out in 2050. We have to combine aging and vision loss programs efforts to achieve this. That means aging has to learn about vision loss has to learn about aging. So here's contact information. Please take a screenshot or take a photo, save my email, and reach out to me if I can ever help. If you have questions, if you have a need to find a resource, if you have people who need your help and you're not sure how to help them, I'm here to help you. Thank you so much.
Thank you. We do have some questions for you if you have some time. Great. So this question comes from Zoom. Hi, everyone. I'm Eric again. This question comes from Zoom. It's what about those living with change, dementia, for example, whose eyesight is being affected due to change of their brain?
Change of their brain. Well, this is a good question. Alzheimer's and other dementias do cause visual perception changes. The eyeballs work fine. The brain simply can't perceive what the eyes are telling it, okay? So there are parts of helping someone who has vision loss because of their eyes not working right so that they can do things such as a talking clock, okay? Hit the top button. It's a great big button. You can't miss it, right? And it says, it's 4:32 p.m. Oh, goodness. I'm missing, I don't know, what comes on at 4:30? Oprah, I don't know, right? I don't watch TV. You know, my favorite show is at noon. I want to make sure I know when it's noon. Little things like that can make a difference. Audio books. The Texas Talking Book Program is a huge resource for people losing vision and people losing visual perception. If you cannot access print for whatever reason, you can qualify for a free program to get a player. The books come to you in the mail, or if you're technology hip, you can download them. And you can have the reading material that you miss, like reading your Bible before you go to bed, reading your mysteries or your favorite biographies. And for those kinds of dementia-related vision loss, those things work just as well. They're very simple to use. They've got big, colorful buttons. It's really obvious, which button does what. If you want to rewind, the pointy arrow going left is rewind, It's pretty simple. And that's the way it needs to be for a lot of people who are losing their ability to enjoy life because of dementia.
Wonderful. Thank you. Any questions from the audience? That's okay. All right. Can we have a round of applause for Neva Fairchild, please?